Hello, I'm Dr. Nandini Manoli and I'm a pathologist. I did my undergraduate at JNMC Belgaum. My MD is from Mysore, that's Mysore Medical College in 1993. It is one of the premier medical college at our time. And I feel proud that I'm an alumni of a government medical college. I have 30 years of teaching experience and my career has been fully fruitful and as I was interested in academics. I started off by my career by presenting cases in our academic society, state chapters, and slowly from there, past 15 years, I got a chance to present my work at international podiums in the form of posters and then paper presentations. I have been lucky to attend international conferences at the podiums like National University Hospital, Singapore in 2008, and at Edinburgh, UK, representing state of Karnataka along with the national team of cytology in UK in 2010, and in 2013 at Las Vegas, USA. My field of research is in cytology, as we felt there was a need to work on it as it was a new subject. It was also a subject which was 20 years ago, but now it is advanced a lot with a lot of molecular work and it is being started in many centers. I'm happy that I introduced the new techniques in cytology to improve the diagnosis for our patients. I have introduced cell block technique for the diagnosis of cancer, which is being routinely used in cancer centers and especially breast cancer. I have started manual liquid based cytology as an essential method for increased detection of cancer of various organs, especially cervical cancer. This is a cost effective in house method in our hospital. I have written several books on these techniques and which have been well received and published by international publishers like Nova Publishers, Lambert, and Scholar Press. The topics of my work are varied, but mainly on cervical cancer since it's an important disease in our country, which is a poor country, breast and thyroid cancers. I have given several talks and webinars from the past 10 15 years, and webinars have become a routine of my life, almost one or two every month. And all of them have been in international platforms of USA, UK, and my work. I'm happy that I'm able to spread to the international people the work what we are able to do in a charitable hospital like ours. And my work also I've got opportunities to go and present in countries like UK, USA, Netherlands, and Germany to take up this career of medicine by my parents. I'm almost who are from Mrs. and Mr. Murugesh Sanikop and my teachers from Belgaum and Mumbai. I'm among the first women in our house to become a doctor, and this became an inspiration to others, to relatives, to educate their girl child. It is a subject which is in demand nowadays. This is a subject which we have to know the why, what, and how about various diseases, especially cancer. I chose this field as it gives me to have a work and life balance. I can manage both my home and enjoy my work within my limits. The most rewarding aspect of being a medical faculty is that I can be a health guide to my family and my assistants. I can give better health care to women of our country. And by researching on the low cost methods like FNAC of the breast, which is the most common cancer in women in our country, and early screening of cervical cancer by low cost method like liquid based cytology, or in short, I call it as MLBC, I am able to help the women of our country. And I can also do a lot of work with the NGOs with whom I collaborate and help the poor women in Mysore district. The challenges I have faced is are plenty. Earlier years, when I was younger, the college was far off from our place, and all the classes we had to prepare by ourselves verbatim, because we didn't have computers that time. There was only chalk and board. So, and students were good in number. So, whoever were there, they were all very interested because access for books was very limited those days. So whatever I teach should be correct and complete. And later on, we went on to the OHP sheets. Preparing a OHP sheet was a laborious process. And but one advantage was there in earlier years, we had attentive students. Nowadays, we have a lot of technology which is can be used, makes teaching more interesting, colorful, but the interest of the students is limited. Only they listen if our classes uh, very useful, or if they find it interesting. So with this information boom, I feel there are both advantages and disadvantages for latest method of teaching. Field has changed a lot from the beginning of my career. In the earlier years, when we were students, or when I was a lecturer, facilities were very limited. We had limited rooms, but still it was very homely. Within the limited facilities, we knew how to make the maximum use of it. Hardly we had syringes, needles. It maybe appears surprising. When I was a postgraduate, we had to boil the syringes and needles and use it because most of the patients could not afford it in the government hospital. But now we have disposable syringes and needles which are very fine and can be used left, right, and center for any number of times on patients. We never boil them nowadays. It's not heard of. So there is a lot of changes, new machines, new diagnostic methods, AI being used in our machines. So this has improved the diagnostic accuracy and diagnostic methods in the medical field. I would like to, since I'm a teacher, I would like to advise about teaching. I think we should get more involved, have a good interactive sessions with students, because a lot of the material they are getting in Google. Many of my students, when a junior faculty goes to take a class, would have kept a Kindle and right in front of them, so that they know I have the information. They'll be just checking out on the teacher, which is not heard of when we were students, because we hardly had the books to have an access. But with the new technology, we should make it so interesting that the students should feel, yes, I should listen to the lecturer. So that is the main aim. Make it more interesting, make it more light, make it more interactive. I think students will like it. The significant changes in modern times is that most of it is a lot of machines are getting involved. Prerequisite techniques have been already put, like an hematology analyzer. You just feed the sample into the machine. It will give you 18 parameters. Hardly we have the time to read all the 18 parameters. Earlier years, we had just had a SALIs, wherein each time any technical error is possible. And so the HB, the basic test, which is the most commonly done, used to be inaccurate. But now with a lot of hematology analyzers coming from various companies, things are more accurate and more easy to give a good report to the patient. I would like to not be very preachy. I would like to see the youngsters enjoying doing a medical course, because it is long, laborious, and it is hard. It's not that it just comes on the platter. So I think I have given some useful tips to the budding doctors.